January is Cervical Health Awareness Month, and the World Health Organization has big plans to eliminate this disease through vaccinations and screenings. And today we're joined by Dr. Luwan, Semere, an OBGYN chief at Kaiser Permanente. Thank you so much for joining us here during Crown 4 News this afternoon. We want to learn more about the prevention and steps that people should take to ensure good cervical health. So first off, what is cervical cancer? What is it in fact? How does it get someone sick?
Thank you for having me and for bringing up this important topic. Cervical cancer is the fourth most common cancer in women worldwide. It is when cancer occurs of the cervix, which is the lower aspect of the uterus. And the most of cervical cancer is caused by the human papillomavirus. In fact, 95% of cervical cancer is caused by HPV.
So how does someone get it?
So any woman is actually potentially able to get cervical cancer. The majority of it is caused by the human papillomavirus, which is a sexually transmitted disease, and HPV is the most common sexually transmitted disease. So anyone who's sexually active can be exposed to the virus.
And who's at risk here? Is there an age group or a demographic that is most at risk?
Yes. So cervical cancer is not very common in people who are in their 20s, but after the age of 30, that is when the risk truly begins, and the average age of cervical cancer is about 48 years old.
So you can get screened for it by your OBGYN. Is that the best way to do it?
Yes, I'm so glad you brought that up, Justine. Screening is an incredibly important aspect of cervical cancer prevention, as is the human papillomavirus vaccination that people can get at early ages before exposure to HPV.
And what does that screening actually look like?
Yes, so in terms of cervical cancer screening, it can involve testing for the human papillomavirus as well as testing of the cells of the cervix to see if any abnormalities of the cervical cells have occurred.
So why have screening rates recently gone down? That was some of the information that I was reading, that people aren't getting tested for this as much as they had been in years before.
That's a very good question, and I think we can all agree that coming to the gynecologist isn't always the easiest experience. So some of it may have to do with discomfort with the examination and having to come in for this exam, which can be perceived as uncomfortable. It is actually a rather quick and simple test that can be done, though.
I would think that early detection would probably be key in something like this.
Early detection is incredibly key. It takes cervical cancer several years to develop, and in that time, if we're able to get people in for screening, we can catch these abnormal cells before they progress to cervical cancer. So that's why it's important for people to come to the gynecologist regularly for their cervical cancer screenings.
With early detection, and then you find out, you do have this, what are the treatments that can be done to help someone get better?
So there are procedures that we can do in the clinic to remove the abnormal cervical cells in the early stages, and treatments that we can do to treat cervical cancer in early stages. But again, the best way to prevent cervical cancer is through regular screenings, the human papillomavirus vaccination. Prevention is key in terms of cervical cancer screening and preventing cervical cancer.
With getting the HPV vaccine, would you say that that's one of the better ways to, does that then link yourself to not be able to get cervical cancer? Is that one of the better ways to prevent it?
Yes, so the human papillomavirus vaccination protects against types 16 and 18, which cause about 75% of cervical cancer. And so if people are able to get the vaccine, it's recommended in earlier age groups beginning at age 9, then they're able to protect themselves before exposure and develop those antibodies that will help to prevent the development of cervical cancer.
Is there anything else that you think is important for us to know as we're trying to get the word out about this being Cervical Cancer Awareness Month?
Yes, so smoking is another risk factor for cervical cancer. People who smoke are twice as likely to get cervical cancer. So avoidance of tobacco and exposure to tobacco is also an important factor in regards to cervical cancer prevention.
Well, we hope people were paying attention and watching, and we appreciate your time so much. Dr. Luwan, Semere from Kaiser Permanente, thank you so much for joining us.
Thank you so much for having me, and thank you again for bringing awareness to this important topic.
Yeah, I hope people are listening and can do something to protect their health.
I hope so too, and I hope people will take the message away to get their screenings and also get the vaccine.
Thank you so much.
Thank you.